Mr. Deputy Speaker, sir. I will be brief about the subject that I'm bringing in, sir. The present conditions of health in the state of Meghalaya. Sir, first of all, I would like to thank the government for all the works that they are doing, especially our Chief Minister for the upgradations of PHC at Kerapara to CHC, which was a long dream of the people of Kerapara, and then upgradations of PHCs, and then sub-centers like Sakaboldamgri, Darangri, Chengapara, Gambegri, Bolchugri, Posangagri, Chisakri, Sakaboldamgri. All this area has been upgraded, especially for the pregnant women to take care. But, Mr. Speaker, sir, I would like to again request in certain areas, like for example, I've been attending to lots of cancer patients from my constituency. Sometimes whenever we send our patients to the hospital, sometimes they don't have this chemo which was given to the cancer patients. So we have to get it from the private hospitals or from the private pharmacies. So these are the problems that we are facing, Mr. Speaker, sir. And then one day what happened is that one boy, he was a very young boy, he was already treated, operated, and completed. But the fact is that when we are supposed to give him the radiations, on that particular moment, that radiology, that who was taking that particular, we call it radiology, so? Radiology, so. Not oncologist, the person who take care of the thing. The radiologist was not there. So that way he waited, but at the end he has to succumb. So these are the areas I think if the radiologists who are giving the treatment to the cancer patients needed to be appointed more. When they are on holiday or maybe on some kind of a suffering, I think there should be others to replace them. On the other hand, Mr. Speaker, sir, whenever we talk about the MHIs, I've been after these MHIs from very long time, Mr. Speaker, sir. Now, it seems like there is a flaw in design, or maybe this MHI is cunningly designed in such a way that the patients are, or the card holders are not getting all the freedom. Now, for example, we have given 5 lakhs for the card holder. But the fact is that whenever any kind of diseases arise to the family, only certain amounts are deducted. Now, it seems like it's not the patients or the card holder or the family who is getting the benefit out of it. It seems like the design in such a way, it's the company who is getting the benefit out of it, more than the public, more than the people. Now, I was so happy that this is the area where we can, help the poorer people who cannot afford to go to, even the private hospitals. Last time, one of my patients was admitted in Supercare Hospital where we don't have certain kind of a surgery. So, certain surgery has to be done in the private hospital. When I send them, and then the bill came out around 2.50 like that. And then from the MHIs, they can cut only 30,000, whereas rest of the payment I have to pay from my own pocket. So this way, if the 5 lakhs was given, why not wholly? So I want the Honorable Chief Minister to relook into this framework if it can be fully, because it's like taking away the fundamental rights of that family itself. Therefore, I would like to request the government to relook into this particular design. Not only certain diseases can be, carried out to look after the patients, but this particular aim of giving the insurance should be wholly for that particular family only, Mr. Speaker, sir. Now we are having a lots of cancer patients within our state.
1 minute.
But there is only 1 or 2 oncologists. So if our government can think of contemplating more to bring the oncologist specialists within our state and the radiologists, I think it would have a better, it will be better for the people of the Meghalaya, people from the state. Now, another thing is that, Mr. Speaker, sir, now lots of children have suffered of this pneumonia and has been they have already succumbed
Time is up.
from 2001 to 2000. Okay, Mr. Speaker, sir.
Yeah.
Thank you. I would like to urge if there is any kind of a mechanism to curb the pneumonia, which is, which disease is killing our children. I want our government to look into this matter seriously. With this few words, Mr. Speaker, sir, I resume the seat. Thank you.
Thank you. Thank you.